Welcome to Aging Insights. I'm Grace Egan, Executive Director of the New Jersey Foundation for Aging. Our mission is to promote policies and programs that enable seniors to live with independence and dignity in their communities. Today we're going to talk about Medicare. Open enrollment season is here, and there are important details that everyone needs to know. In addition, we'll also talk about ways to prevent Medicare fraud. This is something that all Medicare recipients should be on the lookout for. So today's guests are both experts on both of these topics. I have in the studio with me today Charles Clarkson, Project Director, and Angela Ellerbee, Outreach Specialist, both from the Senior Medicare Patrol of New Jersey. We know in New Jersey that more than 1 million residents are over age 65, and many boomers are turning 65 each day. So we want to highlight some of the details related to Medicare open enrollment. And with that, we'll begin the interview with Angela. Thank you both for being here. I really appreciate it.
Thank you for having us.
You work on this in the entire year, and I know your busy season is really open enrollment, and you're both a fountain of information on Medicare issues. So I really am very appreciative that you're here. Angela, would you please describe to us what Medicare is and who's eligible?
Medicare is a federal program, and it's health insurance. Basically, it's health insurance for individuals who are age 65 and older, or you could be disabled 24 months, collecting Social Security disability. You could have ALS, which is also called Lou Gehrig's disease, or end-stage renal disease. You are qualified for Medicare in one of those ways.
And isn't Medicare something that we contribute to?
Well, yes. What happens is if you're working, you contribute. You're contributing to it through your payroll taxes.
And then there's traditional Medicare, and then there's Medicare Advantage.
Correct.
And so can you tell us the difference between
Sure.
those?
There are two ways to get your Medicare needs met. Medicare, two choices. The first one is traditional or original Medicare. Traditional Medicare, you know, like I said, when you qualify for it, you become eligible for it, you receive your red, white, and blue Medicare card. Has Part A hospital, Part B medical on it. With traditional Medicare, original Medicare, you can go to any provider that accepts Medicare, which provider meaning hospital, facility, durable medical equipment supplier, and so forth. So if they accept Medicare, they're enrolled into Medicare, you can go to that provider. With traditional Medicare, which is original Medicare, it only pays 80% of a bill after deductibles are met. So Part A has a deductible, Part B has a deductible, and afterwards you use it, Medicare pays 80% of that bill, and then you would need an additional insurance. You may have retiree insurance that'll pay that 20%, or you have to purchase a supplemental insurance that pays that 20%. So you have original Medicare, supplemental insurance, and then you have to get a Part D prescription drug plan. So if you're taking prescription drugs, we really encourage you to enroll into a prescription drug plan as well.
Okay, so before you explain Medicare Advantage, I just want to say this is a complicated topic.
Yes.
And so that's why I'm very happy we're doing the show. And if I get it wrong, I want you both to tell me. So now Medicare Advantage is different than the three examples you just described, the three parts that you just described.
So you have another way of getting your Medicare coverage, and that's through a Medicare Advantage plan. Now, Medicare Advantage plans are private companies that contract with Medicare to give your Medicare needs, your medical needs as well. So Medicare Advantage plans, if HMO or PPO plans, if you go into one of those plans, those Medicare Advantage plans, which are also called MA plans, and you take prescription drug coverage, you want to get a Medicare Advantage plan that comes with prescription drug coverage as well. What we tell people at the SMP program, we tell them, look, if you're going to go into a Medicare Advantage plan, be sure that the doctors that you go to, the hospital you go to, the pharmacy that you go to, they're contracted with these Medicare Advantage plans. Now, the Medicare Advantage plans, they do give you Part A and Part B services, but under the Medicare Advantage plan, not original Medicare. So you need to use their Medicare Advantage plan insurance card as your insurance when you go to your provider.
So to oversimplify it, which is probably where I'm going, it's like a network.
Yes.
You're getting into a network. And
yes.
so if your doctors are not on that Medicare Advantage network, for all intents and purposes, then you might need to either find another Medicare Advantage provider, I presume?
Yeah, or you
Okay.
definitely have
Okay.
to, because there are individuals who have been going to their doctors for a while,
Okay.
and they switch, let's say, from original Medicare into a Medicare Advantage plan, not knowing that the providers that they go to does not accept these Medicare Advantage plans. So yeah, if you're in a Medicare Advantage plan and your providers are not in network, you may have to switch to another Medicare Advantage plan, or
Okay.
get other providers that accept the plan that you're in.
Okay, so there are choices. That's
Yes,
what I wanted to
yes,
just,
yes.
so it's not just one Medicare Advantage, there are different providers.
Yes, yes, different plans and providers.
And then they also give you your prescription program through the
Yeah,
same?
you want to get a
Okay.
Medicare Advantage plan. If you're taking prescriptions, medication, you want to go into a Medicare Advantage plan that has a Part D plan with it. So it has medical and
Right.
it has prescription drugs together.
Do they all?
Not all of them. There
Oh,
are some
okay.
Medicare Advantage plans that do not offer prescription drug coverage. So that's why
Okay.
we encourage people, if you're going to go into a Medicare Advantage plan,
Right.
you want to contact a SHIP counselor, the State Health Insurance and Assistance Program.
Mm-hmm.
They're a wealth of information. These counselors are trained in Medicare-related topics, and you want to go to one of them, and they will help you
Mm-hmm.
with your choices.
Yeah, I know we'll talk a little bit more about the SHIP counselors,
Mm-hmm.
but it's important for our viewers to know that every county office on aging and a lot of community providers have SHIP counselors
Yes.
that are, shall I say, embedded in their offices. And you're right, there's incredible training, and there are more than 450 SHIP counselors across New Jersey. So I think it is an important resource, which we'll also talk about. Getting back to open enrollment, what are the dates for open enrollment?
Well, the open enrollment's it's October 15th. That's the beginning, and it ends December 7th. And the effective date of whatever choices you make during that time will start the following year, January 1st.
January 1st?
Yes.
You know, as I sort of mentioned, we have more boomers that are turning 65 every day. And not all boomers are ready to step into Medicare, but
Right.
many of them do. And so I want to make sure that if someone is new to Medicare, and let's say they signed up in June, is this something they should be concerned about, Medicare open enrollment?
Sure. I mean, if they have a prescription drug plan during that time in June, let's say they picked a Part D prescription drug plan, or they got into a Medicare Advantage plan, they still have the choice during the open enrollment period to change into something else for the following year.
Okay, so they may want to look at their Part D, for instance.
Definitely, yes.
Okay, so
Yeah.
Part D is the prescription part.
Yes.
Okay. Presumably, there wouldn't be any change in Part A or Part B.
No, no.
Okay.
Yeah, when someone's new to Medicare, they have a certain time frame to join Medicare Part B's and boys. So that's
Sorry, B as in boy.
I
I
love
like
saying
that. That was very good.
that in a nutshell, it's solidified. So they've done that. So they've gone into now a prescription drug plan, but they may say, you know what, I got something that's called the annual notice of change, and I see that the prescription drug plan that I'm currently in may not work for me for 2018, or maybe the premiums went up, or there's a deductible attached to the prescription drug plan now. During the open enrollment period, they always have a choice to do a comparison to find out if there is another prescription drug plan that's better for them for 2018. And they will do that comparison, and they can enroll in that plan as well.
So will people get that notice?
What happens
For Part
is
D?
they won't get an official notice, let's say from Medicare or from CMS or
Right.
Social Security, but the Medicare New Book, they talk about what the dates are for the annual Medicare open enrollment period. You will see commercials. There's a plethora of
Right.
information that's going to be out there. There's also mailings that may come from solicitors that are telling them about their drug plan or their Medicare Advantage plan with prescription drugs. So they will get information, and it also in
Too much.
So,
They'll get
exactly,
too much
they'll be
information.
bombarded with information.
Okay.
So that's why once again we do ask the beneficiary to reach out to a
Okay.
SHIP program or to Medicare, to let us know if they need help.
But the one thing to really check on is the prescription plan. But I'm just really curious. So does someone get a notice for Part D only? You sort of, no,
No,
nothing.
they will not
You
get
just-
official
okay.
notice from anywhere per se.
Okay.
But if they're currently, let's say they have a prescription drug plan.
Right.
They're currently in a prescription drug
Exactly.
plan. You always get information from the plan you're currently in, and usually in that information,
Okay.
they will say something about the Medicare open enrollment period.
Oh,
So
okay.
they'll talk about the annual open enrollment period. They will.
They'll reference it. They
Yes,
won't
they
say,
will, exactly.
They won't say, hey, you better look.
Right,
Okay, that's
yeah.
what we're doing.
Yeah.
Okay. All right. So what kind of resources? I mean, you kind of mentioned,
Mm-hmm.
you know, the booklet and some other things. So what kind of resources are out there for people?
Well, 1-800-Medicare, that's 1-800-633-4227. So 1-800-Medicare, 24 hours, 7 days a week, they're open. If you,
okay.
at 3 o'clock in the morning and you can't sleep and you want to call 1-800-Medicare, they can do a comparison for you. So you can have a comparison done through 1-800-Medicare, the Medicare.gov website. That's Medicare.gov website. Love that because on there is what is called a Medicare plan finder. So the plan finder, you could put your information in the
Right.
prescription that you're taking, and this particular plan finder will find a plan based on the prescriptions that you're taking that's better for you. So they'll give you your annual estimated cost. It'll give you what your copayment is going to be, the cost of the drug, and so forth. And then you can always get that information, like I said, from 1-800-Medicare, or you can go online and you can take it to a SHIP counselor, and we can definitely decipher that for you.
So these new updates will be online as of October 15th or a little
I
earlier?
believe it's October 1st. It should be there.
Great.
Yeah.
Okay, so I mean, that's when we hope people are looking at this program.
Mm-hmm.
And so are the materials available in other languages?
There is. I mean, they have it in Spanish, Portuguese. They have it in
The booklet,
Italian.
too?
Yes, definitely the Medicare book. Yes,
Mm-hmm.
yes. But there's information online that can be translated. And if you do call 1-800-Medicare, they will find someone that can speak your language in order to interpret it for you.
Well, I think that's very important.
Oh,
And as
definitely.
you said, that sometimes actually, even if you've done all this homework, it's really important to maybe speak to a person who can help you go through it. So
Yes.
the SHIP counselors are a really good resource.
Definitely.
So what are the major changes that we've really talked
Mm-hmm.
about for presumably are Part D
Mm-hmm.
and determining if the Medicare Advantage plan you're in is right for you, or you want to go back to traditional Medicare, or you want to do it the other way, go from traditional Medicare to Medicare Advantage. Is that correct? Did I
Yes,
get that
during
right?
the open enrollment period, that's why it's so wonderful, because you can make whatever choices that you want. So if you feel as if you're in a prescription drug plan that's not going to work for you for 2018, or it's not working for you now, you can switch to something else.
Right.
So if you want to go from a Part D prescription drug plan to another Part D prescription drug plan, you can switch. If you want to join a prescription drug plan for the first time, you could do that during that time period. If you're in a Medicare Advantage plan without prescription drug coverage, you can go to a Medicare Advantage plan with prescription drug plan, and vice versa.
We may
So-
have to talk slower. We just might have to talk slower.
So there is a lot of choices
Okay.
during that time. So whatever you're in,
Right.
you can come out of, basically. That's really what I'm trying to say.
What can you not do during open enrollment?
Well, the only thing that I can really think of you can't really do is to enroll into Part A and Part B. There's a special time for that. So when you're new to Medicare, you can go into the enroll into Part A and Part B, but during the enrollment period, that's not the time for it. The Medicare prescription enrollment period, that's not the time for it, no.
Okay, so I just want to also indicate that sometimes traditional Medicare with Part A, Part B, and the supplement and Part D, that they really incur three separate costs. And so when you do a Medicare Advantage, while it is a network plan, there's usually only one bill. All right, is that correct?
When you have original Medicare, there's a Part B premium.
Correct.
Okay, all right. When you purchase a supplemental insurance, that 20% that Medicare doesn't cover, that's a premium for that.
Correct.
And the Part D, as in prescription drug plan, there is a premium for that as well, and it also deductibles can incur. When you have a Medicare Advantage plan, some of those plans have zero premium, definitely. So some have zero premium, and some do have a premium attached to it as well. For the for the plan. Now, with Medicare Advantage plans, there are other costs that are involved. So you may pay a copayment for primary care physician, a different copayment for a specialist. If you go for outpatient surgery, you will have a percentage that you have to pay, and there are certain tests that you have to pay. So we tell folks, if you're going to go into a Medicare Advantage plan, please speak to someone, a counselor, or call 1-800-MEDICARE, and get the information to know what your out-of-pocket costs could be, because you will incur them if you use the plan.
You know, we didn't really talk about this, but I also know there's some subsidies. So can we just touch on that for a minute?
Sure. The prescription drug plan, there is what is called the for Part D prescription drug plan. Like I said before, there is a premium attached to that, and there's also a deductible. Some of them have deductibles, and then your co-payments for your prescriptions. I won't go into the donut hole portion of it. We'll leave that for a SHIP counsel to really explain that to you. But the plan, the subsidy programs, there's the PAD program, the pharmaceutical assisted to the age and disabled. That's Jersey specific. So if you live in New Jersey and you qualify for that program, that will pay for the Part D, certain Part D prescription drug plan premiums, any deductibles. If you're in the donut hole, that'll pay for that, and your co-payment will be $5 for generic, $7 for name brand. They also have the LIS program, low income subsidy program, Extra Help. That's through the federal government. You can qualify for both PAD and the Extra Help program as well. And then there are other programs that's called the SLMB program, SLMB program, Specified Low Income Medicare Beneficiary. That
really
helps,
making you work hard.
That helps for the Part B as in boy premium. If you income qualify and certain eligibility, if you qualify for it, you can get that as well. And there are other programs out there. If you qualify for Medicaid, the QIMBY program, Qualified Medicare Beneficiary, and so forth. So the SHIP, and I keep referencing SHIP because a SHIP counselor, we know all this. That information is out there. And when we talk to and counsel Medicare beneficiaries, we give them all their options. Once we counsel them and we know where they income, their finances, we will give them that information as well.
The only reason why I want to mention that is, you know, it goes beyond what we really are talking about today. But if somebody wants information about the subsidies and really feels that economic crunch, they can call 1-877-222-3737 and try to get in touch with their county office on aging and find out those details.
Yes.
But I just wanted to mention that. I really appreciate you both being here. Charles, can you tell us what the Senior Medicare Patrol is?
Yeah, well, we're a federally funded program by the Administration for Community Living. And basically our job is to go throughout the state of New Jersey and educate beneficiaries about Medicare fraud, waste, and abuse so they don't become victims. And every state, including some of the territories in Puerto Rico, have Senior Medicare Patrol programs. And, you know, really it's, we lose a lot of money every year to Medicare fraud. $60 billion is the estimate. So whatever we can do to fight fraud, waste, and abuse, we all have a role in doing that because it affects all of us. It affects our deductibles, our cost of care. So we want to do everything we can to fight fraud.
And what kind of fraud are we talking about?
Well, I'll give you the top three, you know, billing for services never provided, double billing, upcoding, you know, where they bill for a higher code than the one. And of course, it could be anything, you know, a doctor billing for an extra test, unnecessary medical testing. So it's
Equipment?
a very...
Equipment?
Yeah, oh, sure. You know, in most cases, durable medical equipment, people might buy it and then never get it. And what happens is when you see ads on television asking, you know, you need a back brace, you need a neck brace, don't respond to those. Because once they have your personal information, you don't know what they're going to do with it. You've never heard of them. You don't know if they're honest or dishonest. So, you know, deal with your doctor. If you need a walker, well, your doctor should be able to tell you that. Get a prescription, and then go to a durable medical equipment supplier that's enrolled in Medicare.
And how does SMP help a Medicare recipient with issues of fraud?
Well, we give lectures throughout the state, and we tell people we're available, and we have like 40 to 50 trained volunteers. So if anybody has any issues with their billing or thinks they're improperly being billed or they never got the services, they should call us. And we assign a trained volunteer to help that person fight to get the money back, or for the Medicare Trust Fund to get the Medicare back, to get the money back.
So I know you both go out and do a lot of programs, which I think is really helpful. So how would someone know there are problems? I think there are some notices that they get.
Well, obviously, when you go to a Medicare provider, within 3 months later, you get a summary notice called a Medicare Summary Notice, and we encourage everybody, you have to read it. Just because it's in the notice doesn't mean it's right. It could be a mistake. It could be outright fraud, but you won't know unless you read it. And we also tell people, you know, we have one here, is to keep a journal.
Okay.
Every time you go to a doctor, you write it down. Every time you take a test, you write it down. And then when you get your Medicare summary notice, you compare the two and say, look, it looks like everything is fine, or hey, I didn't write that in my calendar. Am I being cheated? Now, we won't know until we investigate. It could be an error, could be fraud, but let us help you, you know, because it's a very difficult system, and not knowing the rules hurts you a lot.
Right.
And we have been very successful in getting money back to beneficiaries of the Medicare Trust Fund because of scams that are out there that we've uncovered and able to resolve.
Are there new scams that people should be alert about?
There are always scams. We see scams all the time, from genetic testing to, like I said, the braces for durable medical equipment. You know, any possibility. You get calls saying we're from Medicare. Oh, by the way, you know, we want to confirm something with your Medicare records. Please give us your Medicare number.
Does Medicare ever call?
Never.
Okay.
One of the things, you know, there are some exceptions. I mean, one exception really. Sometimes Medicare will do a survey. And they hire a third-party contract, but that's very rare. So we really tell people Medicare never calls you. And if you get a call like that, hang up the phone. Be rude. Don't answer any questions. Yeah, be rude. Don't answer any questions. And, you know, and...
What's on the horizon?
Well, on the horizon, you know, for years, we've been telling Medicare that the Social Security number on the Medicare card is a real issue. Because not only do you have the Medicare number, but you have Social Security number, and you have the effective date when someone went on Medicare, so you could almost determine the month of the birthday.
Right.
And so that's led to a lot of problems with Medicare fraud. So finally, Congress passed a law. I won't go into the name of it, it's very long. And basically they said, hey, Medicare, you have to start issuing new Medicare cards with a random generated number that has nothing to do with your Social Security number. And that will start rolling out April of 2018. But it'll take them a year to issue all the new cards.
Okay.
Well, so your neighbor might get one early, and you might not get one for 6 months later. But there'll be a transition period where you'll be able to use both cards, the old Medicare card and the new Medicare card. But we do expect, as I mentioned to you, a big education campaign to help people understand what's coming, and you'll get some official letters. So I tell people, look, any emails, any telephone calls about the new Medicare cards, do not answer, do not open the email, because these are going to be scams. So now we've already seen, and I've sent you the link about Guard Your Card. So, you know, that's something that we expect, and we expect a much larger campaign going forward.
So you think the Guard Your Card is just the first
Oh,
of
yes,
many?
just the first of many,
So we're
especially letters.
Right. So we're really happy to show it to our viewers if they haven't seen it on their own TV programs. Thanks for mentioning it.
Sure.
Con artists. They'll try anything to get your Medicare card number.
So they can steal your identity.
Commit Medicare fraud.
What can you do? Guard your card.
Guard your card, just like your credit card.
Nobody gets my number, unless I know they should have it.
To protect your identity, new Medicare cards without Social Security numbers will be mailed next year.
Visit medicare.gov/fraud.
Stay sharp, people.
So how now does SMP go out and educate people? I mean, how available are you?
Well, usually I'm almost doing a presentation a day. So,
he too.
and so is Angela. So we're very busy. Remember, we cover the entire state.
That's right.
So think about every senior center, every community center, all church groups, synagogue groups, private clubs. I mean, there are so many outlets.
You go everywhere.
Assisted living facilities.
Yeah,
You know,
yes.
we try to go everywhere. So we want you, if you're listening to this program and you belong to a group, call us.
Yes.
It's free.
Yes.
It's right.
We come anytime, day or night, and we'll give a presentation, and we're quite good, aren't we,
I think
Angela?
so.
Well, I think you're wonderful. And I will say that I do hope people call, because I do think not only do you give the straight information, but you also spend an awful lot of time helping recipients decode, shall I
right,
say, Medicare. So I appreciate that.
Right, and we tell people, you know, you don't need to use a broker or an agent.
Right.
You know, let SHIP help you. Let us help you, because we're not biased. We're not selling anything.
Right.
All we want to do is make sure you have the right coverage and are protected from Medicare fraud.
Yeah, and I think when you look at those Part D comparisons, that really gives you something that you should determine if your drugs are in that.
That's right.
And it gets complicated.
Yes.
And then the supplements, I mean, you know, all of the
Right, and remember,
alphabet
supplements are
plans.
sold by letters, so
Yeah, it's
Part A and
very-
Part B and D, and then you have Medicare supplement plan A to N, you know,
Right.
so there's a lot of confusion.
So it's good to know that not only is SMP out there, but the SHIP counselors are out there
Definitely,
too.
yes,
So thank you
yes.
very much.
So
I really
welcome.
appreciate you being here. So I'd like to thank our guests for sharing their time with us today. Aging Insights is produced by the New Jersey Foundation for Aging. To give us feedback on this show or to sponsor future Aging Insights programs, please go to our website at www.njfoundationforaging.org or call our office at 609-421-0206. We want to remind you to find out about senior services in your area or to reach your local SHIP counselor. Please call your county office on aging. You will see their listing on our website, or you may call the state hotline number at 1-877-222-3737. Thank you for watching this episode of Aging Insights, and remember, aging is everyone's business.